Introduction. Welcome everybody for tonight webinar hosted by Boston Scientific on the latest advancement we have in the space of enlarged prostate and benign prostatic hyperplasia. So really, I'm very thankful to meet with you virtually, and I hope that this webinar will be entertaining and educational for you at the same time. So without further ado, I'd like to kind of, encourage a dialogue between us to really enhance our knowledge in this space of enlarged prostate. So please do ask questions at the end of the webinar. If you have any questions or comments you want to say, please make sure you are posted through the chat function. As I've been introduced, I'm a urologist at the University of Chicago, and I practice actually urology in 3 different locations, one in Hyde Park, the DCAM main campus at the University of Chicago Medical Center, and second one in the South Loop, where I'm actually currently sitting. I just finished my clinic here. The last one of the third location will be in the River East location in downtown Chicago. So really, we'll cover the prostate enlargement symptom and signs overall. We're going to talk about specifically enlarged prostate and what are the latest advancement we have in the space of enlarged prostate. As you know, there has been a lot of newer FDA-approved devices that helps men resume their ability to urinate in a better and stronger fashion. So we are going to cover what is the prostate? What does it sit? What does it do? Imagine this gland, almost like a walnut-sized gland that sits at the base of the bladder. It surrounds the urethra and at the base of the bladder, and it produces fluid that helps the sperm flow during ejaculation. The prostate usually grow over time from the small size when we are 20s to a larger size when we are in the mid 40s and over. The enlarged prostate, or other name for it, so-called benign prostatic hyperplasia, or BPH, it's really linked to obviously a lot of symptoms in urination problems in men, but it really acts differently from other conditions. So make no mistake that BPH is different from prostatitis, which is inflammation of the prostate. Also prostate cancer, which is a huge topic that is not covered during this webinar, but I'm happy to answer any questions after the webinar. This is, again, there's low linkage between BPH or cancer, for example. So we're dealing with a very benign condition, which leads to unhappy urination for men. So what is it, BPH? Again, I mentioned it's benign. It's comes from the prostate, and also it's hyperplasia, which means enlargement of the prostate cells. This BPH name indicate enlarged prostate, and normal size prostate approximately is about 1.5 inches in diameter. Again, that size can gradually over time, when we age, increases in size, and that can lead to pressure on the bladder outlet, leading to what we call bladder outlet obstruction, or BOO, that can cause a spectrum of lower urinary tract symptoms called LUTs, and these symptoms are typically urination problems that we can discuss in the next slide. I want to make sure that we are clear about this, that the BPH is not due to cancer. This is not cancer condition. That is no linkage between cancer prostate and enlarged prostate. Although the symptoms are similar between the two, but there are 2 different conditions. Usually when you have enlarged prostate symptoms, your doctor, your urologist, or local physician will order a test called PSA. Now, PSA stands for prostatic or prostate-specific antigen. It's a blood work that be done to distinguish if you have cancer or not. Usually, the PSA can be elevated in high levels in patients with prostate cancer, for example. As the prostate enlarges inside, as I mentioned, the pressure can be high. And as you can see from these figures, the bladder is right here. The urine is flowing nicely through a small channel called urethra outside the body. Prostate line is right there. It's almost like a circular donut size prostate can actually sit around the prostate and can actually exert some pressure on the area that causing the problems with urination. Oftentimes, will tell me that they are exerting pressure, they are pushing, straining to urinate. They often have some hurting when they're peeing. They are getting up at nighttime to urinate a lot. And oftentimes also they may bleed and cause infections, maybe stones, and ultimately may have retention of urine, which is unable to urinate at all. So these are important symptoms that can be indicating enlarged prostate. So usually, again, men may report frequent urination during the daytime and nighttime as well. They can have urge to urinate, weak stream of urinary flow. They can also have burning when urinating, also unable to completely empty the bladder, right? So, which indicate a blockage in their bladder neck outlet, if you will. And also trouble stopping and starting urine flow as well. Unable to urinate can be a dangerous thing because the pressure in the bladder can be very high. It can cause backflow or back pressure on the kidneys, leading to a condition called hydronephrosis, which is swelling in the kidneys and can lead to kidney failure, kidney damage. So many men with this problem suffer from this problem and can affect their quality of life. Over 95% of men with this problem will, they are not happy with these symptoms. But almost half of them, they have some sexual problems, right? About over 50% will interfere with their normal life and sexuality, and also make them unhappy with their partner as well. Because imagine if you're having urination at nighttime and your partner beside you, you're going to get up twice, 3 times a night. You're going to disturb the sleep, not only for you, but also your partner as well. So these are also quality of life issues that can be associated with this condition. Most common BPH, enlarged prostate, occur in men over the 50. It's estimated to be almost 14 million men in the United States suffer from this condition. So it's a very prevalent problem. Affect, again, men over the age of 50. Obviously, the older you get and you leave this untreated, can lead to reduced quality of life and more symptoms. Obviously, if you have other metabolic problems like obesity and high BMI, maybe you have lack of exercise, maybe this will increase your chances of having severe form of BPH or enlarged prostate. Oftentimes, men will come and see me. I will do a thorough examination and I will take history from them. I will do a rectal examination. I will do some testing as well in the office, which include urine flow as well as bladder scan, post-void urine volume testing, which will indicate how much you're urinating, what the power of urination, and are you leaving urine behind in the bladder after urination, which is not normal. Some evaluation that you can do also online include the American Urological Association Symptom Score, AUA-SI, or the International Symptom Score, IPSS, or even quality of life questionnaires like the Bladder Impact Index. These forms are available in my office. However, you can do it online even before you come back and see me here. This questionnaires will give you an indication or a quantification as to how bad is your symptoms, right? For example, if you are scoring high on the AUA symptom score, that indicates severity of symptoms, right? And may need help with seeing a doctor like myself. So what are the treatment options we have? We know that our obviously oftentimes we start from the least invasive to the highest invasive. Obviously, we oftentimes will tell patients, take care of your diet, exercise regularly, make sure you don't take a lot of fluid at nighttime. We can also add some medication like Flomax or finasteride to help with that. If the patient doesn't like that and they have some side effects, for example, from medication, we often offer them, we call nowadays, which has been the latest advancement in the space, called the MIST or minimally invasive surgical techniques, which include the thermal water vapor treatment to resume, that I'll talk about it in details about it in the next few slides. There's other minimally invasive procedures that we can offer to help men urinate in a better fashion and improve their quality of life. Some data also we have on using some agents like herbal agents. This is our non-conventional therapy for enlarged prostate, including saw palmetto. Although men take it, there has been no evidence that this going to work. Although men like it because it's herbal, it's not a chemical or non-medical, if you will. So if you have saw palmetto, you can try it, but my thoughts on this is that it may not work to improve your symptoms. So what is next? Potentially, as I mentioned, lifestyle modification, lifestyle meaning that including fluid intake management, diet and intake management, exercise on regular pattern or regular times. This will may improve your symptoms, right? This is readily available. You can do it at home. You can just start today if you want, and it will improve things. If you're overweight, you can lose weight. You can improve urination. Not only that, it may also improve your erectile function as well, right? So try to modify what are the metabolic risk factors, for example, that help you improve urination as well. My important message here is really, if you're thinking you're taking a lot of water at nighttime after 7 o'clock, then you may expect you to urinate a lot during the night, right? So I would say that try to stop taking any fluid after 7 o'clock, to try to empty the bladder before nighttime, and that will hopefully eliminate as much as possible of urine from the bladder, so you have better night's sleep. Other condition that we face in our men is sleep problems. So if you have sleep problems during the night, please do check that as well, because urination at nighttime can be linked to a sleep problem as well. My advice is, if you have sleep problems, again, seek a sleep medicine doctor to make sure that you don't have a problem of that nature. Moving to medications, and this is a very common medication we give, which is alpha blockers. This is the likes of tamsulosin or lifileucin, doxycycline. This relaxes the muscles of the bladder, right, and helps the prostate to relax as well, and allowing the urine to flow freely through the bladder into the urethra. So medication are often associated with side effects, which is important for you to understand. The side effects are including for example, the headache, fatigue, drop in blood pressure, dizziness, and also drug interactions, right? There's a rare side effect called retrograde ejaculation or backward ejaculation that you should be aware of. Oftentimes, the patient on this medication will report a dry ejaculation. So please make sure that you are not having the side effects when you're taking the medication. Other medication is called 5-alpha reductase inhibitors. This is the likes of finasteride or dutasteride. These are medication that are designed to stop the growth of the prostate by lowering the production of a very important hormone called DHT, a male sex hormone, right? Like the Flomax, this medication often associated with the side effects such as erectile dysfunction, lower sexual desire, ejaculatory dysfunction, as well as breast enlargement. And we know that most men doesn't like those medications because it does affect their sexual life or sexual performance. So be on the lookout for the side effects. If you do have them, make sure that you report to your doctor. So what is next? I mean, oftentimes for men who are taking medication, not happy, not improving, they're still getting at nighttime, they're developing side effects. We often offer them really the newest technologies to improve their outcomes and urination by using the latest technology, such as the water vapor treatment. Now, water vapor treatment is called Resume. It's an FDA-approved technology to help reduce the size of the prostate, making the channel wide. And I'll show you a nice video to demonstrate this technology we have right now. It's beyond the market or in the hands of doctors like myself for the last number of years now. There's multiple data to show efficacy and safety of this device. It works by an outpatient therapy that uses natural energy that's stored in water vapor to shrink the prostate tissue, right? So it can be done as an outpatient, no anesthesia required, no permanent implants, and the success has been really enormous and great for men with a large prostate. The potential side effects are really like any other procedure that we do in the urethra. Through the urethra, painful urination afterwards. Blood in the urine can be transient and temporary. Sometimes infections, although we do check the urine for infections before and after to ensure that you have no infections, and we give some antibiotics to cover you for that as well. Small risk of having inability to urinate, and also small risk of having urgency of urination. I'm going to go ahead and show you a little video how it works. But before I show you the video, I'd like to kind of go over to this diagram for you. So you remember the prostate is like almost like a walnut size at the base of the bladder, and there's a little thin channel here called urethra. Now, if you have a large prostate, this channel is going to be very narrow and narrow and narrow. And that goes year after year after year to completely, sometimes even completely blocking the pathway here, right? So what happens after treatment of Resume, this channel here between the prostate and the bladder is become wide, and it allows the urine to free flow freely through the channel without any resistance. The Resume, the water treatment, can actually allow this tissue to shrink while it's inside the prostate. Now, let me play the video, which demonstrates the technology here.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
Obviously, you can learn more about this technology through resume.com, the Boston Scientific website, and there's a lot of data there to show the efficacy and safety of this procedure, how it works, what the efficacy of this, and what the patient's satisfaction as well. I'm going to go ahead and move ahead. There's obviously a lot of information also on patient satisfaction that's important for you to understand as well, especially if you're considering doing the Resume water treatment. But remember, this is a natural way of removing the prostate tissue that's blocking the outlet. The satisfaction in men reaching all 97%, which is wonderful to see, and that has been, studied in a large cohort of patients. I'm going to run this video also to from a patient who had Resume, and let's listen to what he says.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Resume procedure was very good. after the procedure, I was a little worn, a little tired, and the next day I felt fairly good, was able to get up and get around.
Since Joe's resumed procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The resumed treatment has made a very big difference in our life.
It's wonderful. So again, I think this is a testimony of the safety and efficacy of these devices and these treatments, which include Resume, obviously. I think that the minimal invasiveness of this procedure allow men to return to functionality really quickly, rather than waiting for a long time to have the catheter removed or getting rid of the side effects from the treatment. So it also can be done in the local anesthesia in the office, which give a different perspective for patient. Most patient doesn't want to come to the hospitals for general anesthesia and so forth. So I think overall, I think the satisfaction has been wonderful. The side effects has been really minimum, and the satisfaction has been really highest, in my opinion. So I want to touch briefly on some other minimal invasive procedures that uses also technology to open up the channel, if you will. One of them is UroLift, or the prostate urethral implants. This is our implants that permanently placed inside the prostate to allow the blockage to go away, and then allowing urine to flow nicely. Remember, this is a permanent implant in the body, so you have to be counseled carefully about that. Someone doesn't like that because if they're having issues with implants, for example, long term, and infections, bleeding, and urgency urination could happen afterwards. Again, you need really to be counseled properly about these procedures, and if you prefer to have a UroLift, I think you should also see a doctor who does these procedures on a regular basis. Other procedures, like also in the space of the mist or the minimal invasive procedure called green light laser therapy. Now, green light is one of the advanced lasers we have in the space, and what it does is vaporize the tissue and eliminate the blockage from the channel itself. There's no permanent implant like the UroLift, but does require a general anesthesia and recovery of catheter and so forth. So you're going to have to really be counseled carefully about what are the possible side effects that could be associated with this procedure as well. I'm going to skip that video in the interest of time. Although, it's already playing. Let's play it. I'm going to speak with while the video is running here, but basically the laser is going into the prostate now, and that laser is very specialized laser that allow the green light to come through and vaporize the prostate tissue from all around the prostate. So you're within the cavity here, and then the laser doing the job here by making the channel wide. And all this vapor is going away, making again the blockage from the prostate enlargement and almost completely disappear. So again, it's one of the minimal invasive procedures that using this technology, laser therapy, you need a catheter, as I mentioned, and there are some side effects that we should be aware of as well afterwards. Again, if you're interested in that, obviously you need to seek a doctor who does these procedures all the time. I'm going to end up with two very traditional way of removing the prostate, which is called the TURP, and also the prostatectomy, which is removal of the prostate. TURP is using a heated wire to cut out the tissue. You're going to need anesthesia, and you're going to have to be also educated about the side effects that are associated with this procedure, such as retrograde ejaculation, ED, incontinence, infection, bleeding as well. And lastly, the prostatectomy, as I mentioned, which is the removal of the prostate from entire mass of the prostate that require again general anesthesia. And oftentimes we preserve this kind of procedures because of the invasiveness of procedure to a larger prostates, over 150 grams and so forth, that allow, because there's risk of bleeding and infections that associated with this procedure and so forth. Men ask me about the coverage. When they come and see me in the office, I can tell them that it's really responsibility of the patient, of you, to contact their insurance and then ask them specifically about this procedure. But we have been very lucky here in Chicago that most of the insurance that we deal with in my practice has been really covering this procedure without any problems. But again, if you have any questions, we are more than happy to allow you to seek to ask the company or ask me or my office to help you with getting insurance coverage for that. So in summary, I think we talked about BPH or enlarged prostate. This is a common condition that happens in the when we hit 50 and over. There are different lines of treatment, such as watchful waiting, medical therapy, herbal therapy, minimal invasive procedures such as Resume, which has advanced the field in providing the latest technology to help men getting rid of the symptoms and enlarged prostate without affecting their life or their quality of life afterwards. Next steps, I would say, would love to chat with you. Obviously, if you are considering doing this procedures, for example, Resume, please reach out to me directly. I'm more than happy to give you a full evaluation, full discussion, and we can really tailor the approach to the best outcome that you want to reach. And with that, I'd like to open up for any questions, and happy to answer your questions for you.